Hello, this is our presentation on the glute medius. My name is Colton Rieger.
And I'm Isaac-Osuna. Okay, so our muscle was a gluteus medius, and the origin for that is the outer surface of the ilium. The insertion for that is the lateral surface of the greater trochanter of the femur, and its action aids in abduction and medial rotation at the hip. The other muscle that we're comparing it to is the gluteus minimus, and it pretty much has the same origin, insertion, and action, but the main comparison is that the medius is larger, whereas the minimus is a deeper muscle, which aids in internal hip rotation. Both are crucial for preventing pelvic dropping. Okay, so for our first exercise, we're going to be covering the isolated concentric contraction for the gluteus medius, which accelerates the hip adduction and internal rotation. So a good exercise for this would be a side laying abduction, where Colton is raising his leg up. He's going to have his toes pointed towards the ground. Yeah, to aid in internal rotation, and then going upward is for hip abduction. So for the question, where would this muscle stabilize? Which joint is it stabilizing and why? So the gluteus medius stabilizes during weight-bearing exercises like walking or running, where basically one foot is off the ground and the other is on the ground. And then it stabilizes at the hip joint, so specifically the pelvis, which is over the femur. And then it prevents pelvic drop, which supports proper gait when walking and reduces stress on the knees and spine. So for the second exercise, we are demonstrating an integrated eccentric action of the gluteus medius, which is to decelerate the hip abduction and external rotation. So I'm going to have Colton here do a single leg squat. All right. And then for our third exercise, we have the isometric action of the gluteus medius, which stabilizes the lumbopelvic hip complex. So a good exercise for this would be a single leg stance, as Colton is demonstrating. Okay, and then here's a list of the antagonists for the gluteus medius. First, we have the adductor longus, adductor brevis, adductor mangus, gracilis, and pectineus. So for the abductor longus, it is an abductor because it pulls the thigh towards the midline, which will oppose hip abduction. For the brevis, it brings the leg inward, which counteracts the gluteus medius, its abduction. For the magnus, it strongly adducts the hip, which is directly opposing lateral movements. And then for the gracilis, it adducts the hip and stabilizes the inner thigh by working in the opposite to abduction. And for the pectineus, it abducts and flexes the hip, which will resist the outward movement caused by the gluteus medius.
Awesome. Next, we're going to talk about how to measure the glute medius's extensibility. First, we will use manual muscle tests to measure hip abduction. That's more the next slide. But for this one, we're going to use tests such as single leg balance test, the forward step down test, and the leg drop test. We're going to watch out for excessive leaning or inability to hold positions, which often will indicate weakness in the glute medius. So an example would be having a box and being raised a few inches off the floor, and then being able to squat down and touch your heel and come back up. People that have a weak glute medius would not be able to do that move very effectively or efficiently. All right, next we're going to measure the strength of the glute medius using a manual muscle test. Next to it we have the protocol, but the way that we're going to measure it, could you lay down on your side in front of me? Thank you. We're going to have them straighten the top leg, and as the PT you're going to have it come back towards you, and then could you roll your hips forward? Yeah. Thank you. And so we're going to ask them to hold it in the air. You're going to push down below their knee, And if they're able to hold their leg up, then they have a 5 out of 5 strength. And as you increase pressure, they're able to overcome that. That shows that they have a strong glute medius. Next, we have an isolated exercise to lengthen or stretch the glute medius. This is a pretty popular one. It's called the pigeon pose. The way you're going to do that is you're going to start on your hands and knees. You're going to bring your leg up to it. Could you tilt it down? Awesome. So you're going to bring your right leg next to your right foot, and then you're going to lean over the top of it, and you're going to feel the stretch in the back of that glute. Some other options would be a seated glute stretch. This is if someone wasn't as flexible. They'd be able to put their foot here, maybe even pull it, and get a stretch across the back of the glute. And then we also have a seated spinal twist, and this is what we all did in gym class. Step, cross, and turn. And that gets a stretch on the glute medius. All right, next, we have an isolated exercise to activate this muscle. We chose side laying clamshells. This, you're gonna lay on your side, stack your knees and hips, and what's important is to keep your hips in full extension rather than keeping them bent. By keeping them extended, we really draw out that glute medius, and we keep a nail through the malleolus of our ankles, and we separate and squeeze, and you'll feel that back in your glute medius. A way to progress the exercise is to use a band on the top of your knees to just increase resistance and progressively overload that muscle. Next, we talk about the functional activity that we use the glute medius for. The one that I chose was sideways stepping. This happens a lot. Imagine you're in the way of someone and you need to step out left or right. Also, I think about how it's a great stabilizer for the pelvis, and someone who has a weak glute medius might not be able to regain their balance after a stumble or a fall. So being able to keep that muscle strong will prevent falls. And then finally, we have potential injury. What we see here is IT band syndrome. And this is where our IT band pulls and causes pain, lateral aspects of both our knees. And this is a great example of how a weak glute medius will cause the tensor fasciae lata to become overworked. This will cause that muscle to become shortened, which will pull on our IT band, causing knee pain. It's really good that we're taking this class and learning about these muscles because we're seeing that this is a hip dysfunction, but it's presenting as knee pain. So if we're able to diagnose correctly, we don't need to spend overly amount of time wasting like looking at the knee, whereas increasing strength in the hip and decreasing the tone of the TFL would improve their symptoms. These are our higher level questions. During single leg limb stance and normal gait, the primary role of the glute medius is to, these are options, and we have B, prevent contralateral pelvic tilt by generating an abduction movement at the hip. And then in a closed chain task such as lateral step down, insufficient eccentric control by the glute medius during the lowering phase would most likely direct which biomechanical outcome. And again, it's B. Sweet. Thank you so much for listening to our presentation.